Today we have with us two State University of New York students who will soon be doctors, and one is Joanna and the other is Jasmine. Good evening, ladies.
Good evening.
It's a pleasure having you both here. So I wanted to start off really, not from the beginning, but I wanted to get an idea, what made you go into the optometry field? Yeah, what was the motivation?
I actually was fit in ortho-keratology contact lenses when I was around 10, 11 years old, and I've been using them for years, and I have a really good relationship with my optometrist. And going through undergrad, I knew I wanted to be in the medical field, but I also knew that I wanted a field where it wasn't just medicine from dawn till dusk. There is a little bit more of a business aspect to it. There's a little bit more flexibility. There's a lot of different pathways you can go into it. And I was kind of just sitting one day and I realized, wait, I really like the eye. I really like how everything there works. I think I should look into optometry school. And then I found out about SUNY Optometry, located right here in the city.
Right.
And everything just kind of fell into place after that. And it just really was a match made in heaven.
Wow. And Jasmine?
So I studied psychology when I was in undergrad, and I really enjoyed learning about the vision and how it connected with different senses in our body. And we did focus a lot on hearing and the audiology system as well, but I really knew that vision had a bunch of different, I would say, effects on our life that are there. It's hard to describe just by, studying psychology, and I wanted to really dive deeper into it. So I spoke again similarly with an optometrist who kind of showed me that there was more than just, what you see, what you feel. There's a lot more, because the eye is connected to the brain, and so it is definitely a huge part of our body, and the way that our body affects our eyes is super important, and it can be a way that you can diagnose a lot of different diseases. By looking at the eye, you can get a sense of what's going on in the body. And so I found that really interesting. And like she said, you can still be a part of someone's healthcare and taking care of themselves by focusing on the eye. So I knew this was something that I definitely wanted to look into more.
Great.
And the ability to specialize.
Yeah.
As obviously everyone knows, when you go into a med school program, it's going to be a little bit of everything for 4 years thrown at you at rapid speed. And with optometry, it really just gives you that option to, for 4 whole years, focus on the ocular system, how the systemic system is affecting the eyes, how the eyes are affecting the systemic system. And it really is just a huge specialization in the field. It is really comparable to dental school, where you spend all your time focused on one area of the body, and we really become experts in it.
Beautiful. Now, for the ignorant of us, myself included, please explain to the audience optician, optometrist, ophthalmologist.
An optician is someone who makes glasses. They go to school and learn how to cut lenses, and they're really focused on the way that the frame and the lens works together. They can adjust frames, adjust lenses. They really understand the optics behind vision, and that's their main focus.
How long is the schooling last?
I'm not exactly sure for an optician.
Either 2 or 3 years.
2 or 3 years?
Yeah.
It's very specialized on that. They don't really focus on any sort of disease or anything like that.
And you need an undergrad for it?
No.
No,
I believe you need a couple hour, like certain hours of experience. And opticians are really, really cool, because at a certain point, the numbers of your prescription, every degree of misalignment can lead to problems with binocularity, which is using the eyes together. It can lead to problems with accommodation, which is the ability to focus at things at near. And so opticians are really integral in those areas where patients have, say, very different prescriptions in both eyes, or a very high prescription or a very low prescription. And so that's where opticians kind of shine and make sure that not only are you getting a beautiful frame that fits your face properly, but the powers in the lenses aren't going to negatively affect you in any way.
Okay. But they don't handle contact lenses?
No.
Okay. All right.
An optometrist is a primary eye care provider. They can treat and diagnose eye disease. They can prescribe glasses and fit contact lenses. Not only just a soft contact lens, like people may know, there's lots of different types of specialty lenses that we're trained in fitting. And then typically we can manage patients with a whole host of eye diseases. We do 4 years of undergraduate coursework, and
Wow.
then there's entry-level testing to get into the program, and then it's a 4-year program with the option of additional residency training, that's what I'm doing right now.
Okay.
So the difference between that and an ophthalmologist is that an ophthalmologist finishes their 4 years of undergraduate degree, they do medical school, and then they specialize in ophthalmology, and they are the ones who will perform surgeries such as cataract surgeries or retinal surgeries.
Right. Okay.
Yeah.
Why not just go into ophthalmology? Why just stop with optometry, since it seems to be just as grueling?
It is
process.
just as grueling, but ophthalmologists are surgeons first and foremost, and that is why they went to school. Their passion, their focus really does lay in the surgical aspect of the field of optometry. And so optometrists and ophthalmologists are very dependent upon one another. Is that optometrists usually see the pre and post-op of surgery, that we clear you for surgery, then you have your surgery done, and we follow up after surgery with you, because the ophthalmologists are very, very busy. And when ophthalmologists specialize in a certain area of surgery, they're not focused on making sure that your soft contact lenses fit properly or that you have glasses. And obviously, I'm not speaking like about every single ophthalmologist. There are ophthalmologists who kind of lean more in the refractive direction or lean more in a binocular vision type of direction. But for the overall gist is that ophthalmologists are performing surgery on the eye. They have the ability to manage a surgery under general or local anesthesias. They're able to do injections. They're able to kind of do like oculoplastics and reconstructive surgeries and everything like that. And optometrists, our main focus is on the overall health of the eye. We're able to check every aspect of that during a comprehensive eye exam. The refractive capabilities of your prescriptions, your glasses, your contact lenses. And we are also able to diagnose certain neurological conditions and focus on the systemic health of the eye, because the eye is one of the first places that changes occur when you have conditions such as diabetes, hypertension, or even some cancers can metastasize to the eye. And so we're able to catch all that.
Let me ask you, why is it that, first, the brain-eye connection? In the development of the fetus, is the brain and the eye one cell group and then they
It's all the same system. The eyes are a subsect of the brain.
The eyes are the subsect. And I think that's something that many people don't really understand.
Exactly.
That they're
very,
connected.
very interconnected.
Yeah, the eye is an outpouching of the brain. So it's directly connected, and then issues in the brain can manifest in the eye and vice versa.
Right.
Yeah, which is why certain like eye infections are very scary and very serious. And if you ever wake up with a random red eye or a random discharge that you're not really sure what's going on, it's in your best interest to be seen as soon as possible, because that infection can actually travel along the blood vessels and the nerves of your eyes into the brain.
Into the brain. Okay. I think that's something that people don't really understand. They see the eye, myself included, that the eye is just a separate system, the brain is a separate system, and they just have an extension cord between the two of them. That's not the case.
I mean, listen, I wasn't really aware of that before I started school.
Yeah.
And so the first 2 years of school were definitely very didactic and lots of lectures, lots of PowerPoint slides. And that's kind of where we start inside out and learn really how everything was connected. And I really was very surprised by the interconnection of everything. And at this point, it's all I can think about.
Do they explain in the development of the fetus, as I was mentioned before, that the brain is one group of cells, and then that cells, when they subdivide, the eye develops separately? Or is it two separate clumps of cells and they just kind of join?
So the embryology is a little bit more complex than just like one set of cells.
Right.
The body as a whole, there's like lots of different types of developments that occur, and like certain parts of the eye will be made of certain types of cells,
Right.
and the same thing goes for the brain. But we're not sure of the exact, like,
Okay,
off the
well,
top of our head.
I didn't want to throw you a curveball.
No, you're fine. But
Yeah.
it's the most important thing to know is that the eye is a outpouching of the brain, so they have
Right.
this direct connection. I mean, the eye and the body are also obviously connected,
Right.
but I think it's interesting how you can find issues with the brain by looking at the eye.
By looking at the eye. That's fascinating.
In the same way the brain is all electrochemical signals, all
Right.
our neurons are synapsing on one another.
Right.
The eyes are essentially giant neurons. Why do we see? It's because light stimulates neurons in
Right.
the back of the eye. That
Right.
signal gets sent further
Right.
for processing of
Right.
what am I looking at in the brain.
Right. So is the optic nerve just another part of the eye? It's not like a separate, it's not like blood vessels between muscles. The optic nerve is an outcropping of the brain and the eye. So
It's essentially like
They're how
it's
connected.
like an elongated brain, except one part of it.
essentially because
one part
all
of
the
it is
neurons in the eye kind of
collects-
sit on the back of the eyeball.
Right.
And then all these neurons, all their axons, which is the end part of a
Right.
neuron, they all go out through the back of the optic nerve and then
Right.
they go along the optic tract for processing in the brain.
Right. Okay.
And so all that is where that connection lies.
Right. Right. So when we look at the eye is not a separate, it's not like your arm or your leg. The eye is actually just an outcropping of your brain.
Exactly.
And it's just a nerve collector. It's a stimulant collector.
Essentially, yeah. That's all the eyes are.
Extension of the nervous system. Okay, we'll get past that technical, but just curiosity. Full disclosure, I was pre-med. I thought I was going to go into eye research. My father had horrible eyes. I was like, I will never have that problem because I'm going to solve it, damn it. Of course, I'm still waiting. Enough said. So anyway, how has it been? How has school been? Has it been everything you expected, more or less?
Definitely more than I expected. I think I was initially part of the general population where it just kind of, oh, like if you can see fine, why do you have to go to the eye doctor? Like
Yeah.
I can see, what's the issue?
Right.
And most people usually end up going just because they need their DMV form signed or something like that.
Mm-hmm.
And so I think one of the most incredible things to me was just this connection and how many facets to optometry there are. Because I walked in, I was like, all right, what's better? One or two? I
Right.
got it. Let's prescribe some glasses.
Mhm.
And then next thing I know, I'm sitting there and I'm explaining how a patient's diabetes is affecting the back of their eye and how the comorbidity with hypertension,
Right.
that they should really be going to their primary care provider because they haven't seen them in a couple of years. And
Right.
I'm seeing their diabetes progress through
Right.
the back of their eye.
Wow.
And the patient's staring there like, what?
Yeah.
Like,
yeah.
how'd
What are
you do
talking
that?
about? Yeah. Yeah.
Or even like when you ask patients, oh, have you recently had a stroke? And they're like, what? How'd you know? We can see it. Exactly.
You know?
Yeah, I had a great time, but it was definitely a hard 4 years, you know.
Really?
It's definitely a lot more work than you expect. There's a lot of examinations and
I mean, if I could interrupt you,
Yeah.
just the whole idea of course, it was a long time ago in a galaxy far away when I graduated from high school. I didn't realize that, okay, instead of going to normal college, you went to optometric college. You know, that idea, I guess it never presented itself or I didn't inquire about it. I didn't realize that. Did your guidance counselor show it to you? Or as you said, you were speaking to your optometrist and...
Yes, when I was in undergrad, my school didn't really have a pre-optometry kind of, they had a pre-med department, but there was really no pre-optometry department. So
Okay.
I kind of graduated undergrad, got my bachelor's in biology with a minor in physiology and neurobiology, and then kind of went on Google and was like, how do I get into optometry school? So it's a separate 4-year program. So
Separate for you after
after undergraduate.
I'm on year 8 right now.
You're on year 8.
Year 8.
So it is,
It's
a grind.
been a journey. It is. And
it's no joke.
it kind of is a surreal moment when you're sitting in the lecture hall and you're jotting down the kidney.
Yeah.
And I'm like, how? I'm like, what? Why? I thought,
Right.
what's
I thought you
happening
were for
here?
the eyes a little further higher.
Exactly. But the kidneys affect the eyes. Everything affects the eyes. And that's
Wow.
one of the most incredible parts is that the vessels in the back of the eye are some of the most delicate in the body. So
Right.
any type of change that affects anything vascular, hypertension, diabetes, any kind of illness that thickens birth control affects the blood in the eye. And all that is shown first in these teeny tiny delicate vessels.
Right.
Because they, when they're under any type of pressure, they'll show that first rather than the larger, more dense vasculature through the rest of your body.
Right, right. Bottom line is that you had 4 years of college. Now you have 4 years more of medical training. And the first couple of years, I understand, are just classroom?
It's a blend of didactic and clinical experience.
Okay.
So the first year, obviously, we spend a lot of time in labs. Like the residents are in the labs with us, teaching us, perfecting our techniques. We're doing a lot of lectures, a lot of exams. And then the second year, a little less lecture, a little more clinic. Third year, little less lecture, a little more, even more clinic. Fourth year is straight clinic.
Fourth year is straight clinic. Okay. And you're in?
My fourth year.
You're in fourth?
And I'm a resident now.
And you're a resident now?
Yep.
Okay. So bottom line is you've come to the end of the road.
We're almost there.
And you've had a lot of interaction with patients. And what's your perception, number one, of the public's knowledge of eye care? I mean, do you feel that people take care of their eyes? Do they really know what's going on? They kind of take it for granted, and it's like,
it's the same.
I'll get around to the
It's the same as it was before I started school.
Yeah.
If you can see, you're happy.
Right.
As long as you can see, wake up in the morning, open your eyes, your sight is intact, nothing could be wrong.
Right, right.
And I mean, Jasmine can talk to this a little bit more about how diseases, really long-standing chronic diseases, how they affect the eyes. That often the changes aren't like you broke your leg, you wake up in the morning, you can't walk. It's more subtle.
Right.
Yeah, I definitely think that we are lucky to be able to see lots of different patients from all different types, walks of life. And some people know a little bit about their eyes. Some people know a lot more. Some people do a lot of their own research. A lot of people who...
Getting a lot of Google doctors?
Yeah, sometimes. But also people who have been going to an eye doctor for a long time or have been diagnosed with specific conditions may know more about their condition or similar conditions. And I think the purpose that we have is to educate our patients.
Okay.
And so if you want to be involved in your eye care, you can be, and some people choose not to be. We have patients that are able to learn from us and then decide, how involved they want to be. Do they want to come to all their follow-up appointments? Do they not want to? It's kind of up to the individual. All we can do is educate them the best that we can.
Right.
And I think that there are some people who are more conservative and who do want to learn a little bit more, so they just know more.
Okay.
There are people who it's not their fault that they don't know, but until they come to the eye doctor, they don't really know how important eye exams are. And sometimes people don't know how often they're supposed to be going to the eye doctor and how to best take care of their eyes. But oftentimes when we are able to treat our patients and educate our patients, they then learn, and information does spread like through word of mouth. And so some people will come in knowing some things like that they just assume are the best way to take care of their eyes because of what they've heard. And sometimes it's right and sometimes it's wrong.
Right, right.
Yeah, and it's our job to kind of put patients on the right path. I mean, I think by the time you are a resident, you and I'm getting pretty good at figuring out which patients are really just there because their wife forced them to go or because they need a form signed for work.
Right.
And the patients who genuinely are able to kind of listen and really want to implement a routine that helps them take care of their eyes a little bit better. And at the end of the day, it's not our job to scold anyone. It's not our job to how dare you don't go to the eye doctor? I can't believe you would ever do this to yourself. It's not our job to be the villain in the story. We're there to educate you and make sure that your eyes are as safe as they possibly can be, because at the end of the day, the eyes are attached to the brain that makes the person.
Yeah, it's true.
So we not only work with the eye, we work with the brain and the whole personality.
Now, I've been going to SUNY since I was a kid, unfortunately. And but fortunately, my parents took me to a great place. And vision care for children. How is that different? How does that manifest itself? For instance, I don't know if it's a PSA, but I see something like, have your child's vision checked after 6 months or a year or something. And I'm like, oh, exactly how do you do that?
So there's programs in place such as Infant C spelled in as SEE, actually C. Yeah. So people can bring their children to the eye doctor from as little as a few months old.
Wow.
It kind of depends on the child and their needs at the time. So
Okay.
we do eye exams on newborns. We can fit newborns in contact lenses.
Really?
There are situations where that may need to be done earlier. Sometimes children don't come in until a little bit later. We definitely recommend certain points in their life for children to go get eye exams. But oftentimes when kids get to about school age, they may even get recommendations from the school to bring children in for their eye exams. They're done a little bit differently. But it's important to, talk to your pediatrician as well. They can give a lot of recommendations on when they recommend children to come in to be seen. Certain children need to be fit in glasses as early as a few months old. And, Joanna could probably speak to this as well, but sometimes children will have congenital conditions where they need to be fit into contact lenses early on.
I think the most important thing to remember, especially when it comes to pediatric optometry, is that when you're born, the retina is not fully developed. The retina continues to develop and completes developing by the first year of life. And so when a baby is born right away, they're actually very, very farsighted.
Okay.
So babies can't see anything within the 2 feet in front of them.
Right.
So they only reach realistically adult levels of ocular function around between 7 to 9 years old.
Wow.
And so one of the most important things, and why it's a recommendation to bring your baby in for an eye exam at 6 months old, is that any type of blockage or any type of distortion to the visual signal, aka just being able to see anything, any type of distortion, interruption, or problem with that means that your child's retina is not going to develop properly, and they will almost be guaranteed to have a lasting vision problem for the rest of their lives.
Right. So let me go down that path, which is something I always thought about. The brain itself has this nerve ending called the eye. Yeah. Why does that nerve ending have disease? I mean, are we at any stage where we can understand why that nerve ending has disease? I mean, we have many nerve endings. But why does that nerve ending seem to be sensitive to either genetic deformities or, one other,
you mean
whether
the
it
optic
be...
nerve? Is that what you're referring to? The optic nerve?
Well, the optic nerve and the eye itself. You say the eye itself, or is it always the retina when we talk about nerve disease? I mean, eye disease.
So eye disease is, you can look at it, think about it just like the body. The same way someone has a part of their brain that was underdeveloped and you see physical abnormalities. The same way there's a
6 fingers, whatever,
all that.
Pterodactyly.
The eye is part of the systemic system. It's not isolated from any type of gene malformations during development. And we kind of think about the eye as front of the eye, so the anterior segment, the kind of inside the eyeball, which is including the retina, which is the wallpaper in the eye, and then it's behind the eye, everything extending and touching the brain. And so any one of those sections can be affected by a disease process, whether it is acquired through injury or through infection, acquired health conditions.
Well, I mean, but isn't primarily the issue? I mean, everybody's farsighted, or most people are nearsighted.
You're born farsighted.
You're born farsighted.
And then you are supposed to be ametropic by the time you are around 5 years old. But that just means you don't need numbers, don't need a prescription to see anything. And then, but however, because that doesn't always happen, because the development of the retina is a multitude of factors, the visual signal entering the back of the eye, just what activities are you doing, you either become more farsighted or you become nearsighted.
Could be genetics as well.
Yeah, so 2 farsighted parents are more likely to have a farsighted child.
So what percentage of the U.S. population is either farsighted or nearsighted? No?
I don't know the exact
20%,
number.
30%?
I don't think there's
70%
I think it's
have a refractive error.
Okay. Do we think it's environmental, or we think it's primarily genetic?
A lot of people are
nature versus nurture.
Yeah, there's a lot that goes on, but most people.
This whole idea of Oh, you read a lot as a child, so therefore your eyes didn't develop properly, or
There's a lot of research that goes into near work and how it affects the eye.
right.
But typically,
I've been hearing that for 40 years. Are we any further advanced than that, or we still don't know?
Well, now we know that it is a factor influencing
Reading
the
a
eye.
lot as a child.
Reading a lot as a child. That outdoor time is protective against myopia.
Okay.
which is when you have a minus prescription.
Yeah. And so I feel like right now is
Mr.
all the rage
Myopia,
with parents, that, oh, myopic progression, myopia, like preventing myopia progression, myopia control, like ortho K contact lenses, atropine eye drops, all this stuff. Because studies have shown that there is a correlation with less outdoor time and more near work contributing to the progression of.
The outdoor time is a function of ultraviolet light, or
there isn't a lot of information to back up exactly what the mechanism is, but they found that the outdoor time is protective.
Really?
Yes.
So, is the human eye, sensitive to? Is ultraviolet light a negative factor for the human eye, or is it?
UV light can cause a lot of damage to the eye. Typically, we see damage to the eye from UV light manifesting as changes in the lens of our eye, yellowing of the lens. That's called cataracts.
Yeah, cataracts.
And you can also see signs of on the front of the eye. Some people will form almost like elevations on the front of their eye and the white part of the eye called the sclera. Yeah, there can
kind of be counterproductive from a nature standpoint that the planet we're on is destructive to some component of our body. Doesn't that sound kind of counterintuitive?
It's kind of like similar to your skin, you know, too much time outside can be damaging to your skin as well.
But even that is kind of weird, no?
That's why it's important to protect your eyes from UV damage with sunglasses and wide-brimmed hats, for sure.
So are you trying to do a promotion for Ray-Ban
or
something?
Just saying, it's something that we do recommend to people.
Yeah.
And so that's one of the best parts of optometry is that we are taught all these studies and we are always reading them, always keeping up to date on them. SUNY does an incredible job about keeping all its doctors up to date on the latest studies, the latest results and conclusions coming out in peer-reviewed articles, government-sponsored research through the National Institute of Health, for example. And so we have all these facts. So you can't exactly say oh, if you spend exactly 35 minutes in the sun, it'll be protective for your child. But we have all this knowledge from all these studies that are coming out and all the most updated information. And so every time you come to us in an appointment and you're asking these questions, we're drawing from not only our textbooks and what the doctors taught us, but we're drawing from the newest research.
Okay. How do you work that into your busy schedules? Because I did an internship program at Cornell Medical Library in East Side, and I put away all the journal, the JAMA, and I was like, when do you have time to go through all this? And I know I used to ask my sister, when do you have time to read all this
So
stuff?
optometrists have to do continuing education.
You do?
Yep.
So when you're in school, you're constantly learning about these studies. And then when you graduate, part of your licensing is that you have to get a certain amount of continuing education credits. So there's lots of conferences that are held where you can learn about the current standard of care and the current studies that best support the treatment and management of diseases.
Yeah, and this is something the entire medical community shares as a whole. I mean, whether optometrists, ophthalmologists, plastic surgeon, anything, psychiatrists, we all have conferences and we all have certain requirements to keep our licenses active. It's not just enough to pay the fee and then check off and move on and do things the same way you've been doing for the last 30, 40 years. It's a requirement to stay up to date on the latest information and the latest kind of research.
So how do the current society affect you? I mean, you have kids with video games, so they're in there all the time. So they're not outside getting whether it's vitamin D or sunlight or some unknown. And then you have the weight gain of the society. So now you have this increase of diabetes and hypertension. I mean, it's an epidemic now. You know.
I think keeping yourself healthy in the same way that you may keep yourself healthy to protect your heart and other parts of your body is how you keep your eyes healthy. So
Okay.
we
Did I mention
definitely,
we're going to be doing a PSA next week, so you're going to have to come back here.
yeah, but definitely,
Eye care is healthcare.
yeah.
Eye care
So
as well.
definitely
Mhm.
making sure that you are eating well, exercising, and following up with all of your appointments, whether they're your primary care appointments, your dentist appointments, your any other dermatology appointments, anything you're doing. That's how you make sure that your whole body is healthy.
Right.
Exactly. The healthier your body is, the healthier your eyes will be. And one of the best things that we can do for kids, especially with this new onset of video games and everything, with less outdoor time and Zoom schooling and everything's on your laptop and you're not really looking at the whiteboard anymore,
Right.
is get properly fitted for glasses and have a proper correction. That is the most helpful thing, because glasses do not weaken the eye.
Yeah.
Myth that glasses can make your eyes worse. If they're
Yes.
properly prescribed, they should never be doing that.
Right.
It's kind of like saying that wearing a shoe that isn't too small or shoes that are slightly too big will make your feet change size.
Right.
Like, it's not really, the glasses are a physical representation of the optics within the eye.
Right.
That every millimeter that your eye is longer or shorter, or every single angle or curve that is on the front of your eye, is just physically represented with a prescription and a pair of glasses.
Right.
And so the only thing you're doing by not wearing glasses is making your eyes more strained and making you work harder and think that you're actually fixing a problem that cannot be fixed.
Right. You know, you had mentioned before that, you know, you don't want to be the bad guy scolding people. But, and maybe it's a function of the way I was raised, but I see that human beings get more motivation from scolding they get from either praise or non-communication. And I always thought that SUNY was kind of lacking in the fact that, okay, listen, you're at this stage. Here's the steps, 1, 2, 3, 4, 5. That gives you the best chance of things not getting worse. And I always thought that there was space for that. And, you know, and of course, you know, I've seen a lot of people at SUNY. You know, there was always the idea that, okay, I may get hit in the head with a baseball or something and it's going to make my eyes worse. So, you know, there's all these myths out there. So do you feel, you know, if you were in charge of SUNY, that there's a place for more proactive conversations, or are you just always reactive? You know, you're just, okay, this is what we see now, and you just keep doing what you're doing because we'll be here to, you know, solve any problem.
I think we approach every patient with compassion and care. At the end of the day, we just
Define compassion and care.
Compassion
These
and
are
care.
just words. What are
are
the
just
actions behind the words?
That it's not my job to judge you. It's my job to protect your eyes.
Okay, all right. When you say judge, that's pretty severe. If I tell you, I'll give you a quick example. My sister, who's going to kill me, if I had a patient come in, the patient tried to put on the gown. The gown didn't fit, right? Because she was an overweight woman. The woman says to my sister, this gown is too small, all right? Now you don't want to judge. So A, do you say nothing and look for a larger gown somewhere? B, do you tell the person, these gowns always fit small? Or C, do you tell the person, you know, we really need to talk about your weight?
I think, I mean, that situation kind of, we don't really deal with that kind of situation
I understand
specifically,
that, but
I
I
think when it
understand
comes to, if we're not lying to our patients, I think
No.
that's a big thing, is that
Right.
I think most of the time we approach everything, like she was saying, with empathy and compassion. So
Right.
we are not trying to hurt anybody's feelings in the process. We want to be understanding that people may not understand a lot of their diagnoses or a lot of the
Okay, here's the thing. You don't want to hurt anybody's feelings. If I give you a diagnosis that is not pleasant, are you telling me the facts or are you hurting my feelings?
Oh no, we tell everybody the facts. Like we
Okay.
tell everybody everything straight up as it is, but we also approach it in a way where we are trying to be understanding of the reactions that they may have to what we are saying.
Understood.
We try to deliver bad
It's
news.
a fine line, right?
Deliver bad
Exactly.
news, but
Mhm.
also deliver in a way where we are not just robots, so that we
No.
understand
And we're also
emotions.
emphasizing the seriousness of these situations.
Right.
We're obviously talking about right now not your average 25-year-old female who has a little bit of dryness and has to use artificial tears. We're
Right.
talking about people with comorbidities of
Right.
diseases, whether it's you have a problem in the anterior segment and a problem in the back of the eye, and you need to be on several medications, and you need to use specialty contact lenses, and you need to be getting injections on a
Right.
quarterly basis. Every single patient interaction ends in two ways. Either that patients come back to you
Right.
so you can continue to provide care,
True. You have
or
that problem.
they are turned off by
Right.
your personality, the way you're
Right.
delivering news, the way you're making them feel, and they don't come back.
Right.
And what if they don't come back not only to you, but they don't come back to
Any.
eye care in general?
And I
I've
think
heard that a
another
lot.
example of that would
Mhm.
be the way that you phrase what you're saying is
Right.
important, and not holding back. Of course, we have the same end goal. If we want to tell someone that they
They're
have
harming
some-
themselves.
or
Right.
and here's an example. In some of the clinics that I work in, patients have severe end-stage disease. For
Right.
example, when you reach maybe severe end-stage glaucoma, it looks different for a lot of people, but for some people, that means they may have a hard time mobilizing. They may have a hard time getting around.
Right.
And so what might benefit them is special technology
Right.
that can help them in their day-to-day functioning. That may be some sort of magnifying lens. It may be some sort of telescopic device.
Right.
And the clinics that we have that can help with the treatment of these diseases and also aid in a patient's functioning by giving these devices or
Right.
prescribing these devices. We have a clinic called the Low Vision Clinic.
Right.
And it may be easy for you to hear the words low vision, but it may not be easy for every patient
Right.
who is at that point to hear the words low vision.
I understand.
Even if we're
Mhm.
we're not saying that a patient necessarily has low vision, they may have a difficult time getting around and may benefit from the services in our rehab clinic, our low vision clinic.
Right.
So something that I've learned in being compassionate and delivering this news and trying to help our patients is that I may not show up and tell a patient, hey, I would recommend a low vision appointment for
Right.
you. I hear that, and I would not love somebody saying that to me as well.
Right.
Instead, explaining what this clinic has to offer without maybe using that name, maybe using the vision rehab clinic,
Right.
maybe using different terminology to explain what this clinic has to offer, what these specialists have to offer, can help a patient make the decision to kind of move forward with that step, a harder step that you may be scared to take
Right.
if you are told that you have an end stage
Right.
disease.
No, words are important. No
Exactly,
doubt.
and especially in my desired field of specialty is going to be specialty contact lenses. And
Mhm.
so on the 8th floor at SUNY, contact lens overwear is a huge problem.
Mm.
And I have people who have never been told that contact lens overwear is a problem, and that especially whether it be a soft contact lens, a hard contact lens.
Right.
And soft contact lenses are their own
Right.
issue at the end of the
Right.
day.
Right.
Every time a soft
Infection
contact
and
lens is
everything.
on the eye,
Mhm.
your eye isn't breathing because the contact with the air is how our eye breathes.
Right.
So every time a contact lens is on, and obviously technologies have gotten much better these
Right.
days, that there's more oxygen permeability and oxygen transmission going through these materials.
Right.
But patients will put a soft contact lens in and then take it out a month later. And then
Mm.
they're surprised when
Yeah.
problems
They have
occur.
problems. Mhm.
And with specialty lenses, the same way. Scleral lenses are a type of lens that can really have a profound impact on a
Mhm.
person's vision.
Right.
And so
But SUNY is still recommending monthly lenses, no?
100%, we
Okay.
still recommend everything. And
Mhm.
it's our job to give you all the resources, saying that you want to, if you wake up at 6 a.m., pop your lenses in, go to a full work day. When you come home, take those contact lenses off.
Right.
Don't take them off as the light's being shut off for bed and drop them on your floor.
Right.
Give your eye a chance to breathe.
Right.
And it's our job as practitioners we will never fit a patient in a contact lens without having this discussion first.
Right.
And we say, do you think you have the mobility to insert and remove contact lenses?
Mm-hmm.
Do you think you have the resources to access a clean environment to insert and remove contact lenses?
Right.
And these are all discussions we have and judgments we make whether or not a patient would be a good candidate for contact lens wear in the first place, because contact lenses are medical devices.
Right.
And problems with contact lenses, the end result, worst case scenario, you go blind.
Yeah.
And that is what we tell our patients, that I'm not going to sugarcoat it. You are risking your eyes by wearing contact lenses, but with proper wear and care techniques, with proper sterile handling of lenses, respecting the contact lens, respecting your eyes, making sure that you wash your hands before touching your eyes, you keep the lenses in a sterile environment, you're not reusing the same fluid every single day in your contact lens case, you're replacing cases on a regular basis. All these little habits help take care of this medical device that helps patients see.
My brain was like, okay, guilty.
Exactly. But you see, that's not, it's life. It's human. You had a really, really hard day at work. You fell asleep on the couch in your lenses. And then all of a sudden you have a really hard month at work and you're sleeping in your lenses every single day.
Yeah.
And that's where I kind of enter with this compassion. And I want to talk to my patients and say, like, how are you seeing? Good? Okay, cool. Great. See you next year. I want to know, like, hey, I'm noticing that this kind of looks a little bit different. Like, this is usually what causes it. Let's talk about it. What's going on in like work that you can't do this, or what's going on at home that you can't do this? Do you want me to help write a note for work, kind of explaining your requirements a little bit more? And that's where the human aspect comes into optometry, because we don't have a schedule loaded with surgery appointments. So in my opinion, I feel like you get a little bit more time to speak to your optometrist. And you get a little bit more time in the room with them. And so your optometrists, if you're going to one for 20, 30 years, you bring your entire family to that same office, they have this unique perspective of this consistency working with the same patients over and over. And so when we see, oh, came in with an infection, my family had a crazy week, I went in the pool and I completely forgot to take my lenses out, can you help me with this? That our job isn't to like, shame on you, how dare you behave this way, like how dare you not take your medications, how dare you do this. We tell you, hey, this was a risky behavior because A, B, C. The way you prevent this is like A, B, C, and this is how we help you, A, B, C. What works, what doesn't, what do you think? And that's how I approach every appointment.
You say that, but I want to tell you back in the day what Lobasi used to do to me, but that's another thing. We're going to take a break, folks. Hold on. We'll be right back. Hi, we're back with Health is Wealth, and we continue our conversation on eye care and how to take care of those peepers. Okay, so we were discussing during the break eye appointments and how often to have eye appointments and why so many other people are ahead of you during your eye appointment, and put aside 2 hours of time for your eye appointment. And damn it, that's how long it's going to take. So get used to it. Okay, sorry.
No, so I think
just a little rant there.
So in terms of how often you should be going to the eye doctor, we recommend once a year for sure. Certain patients may need to be going even more frequently than that, as often as maybe even every 3 months for an eye exam, kind of depending on any conditions that you have and how often they should be monitored. At SUNY Optometry, it's a teaching institution. Oftentimes the exams take a little bit longer because there's several people that take a look at the same patient. And because it's a teaching institution, we're making sure that the students are able to really learn from each patient encounter. So it's not as quick as it may be in a private practice setting where it's just the optometrist.
And it's important to remember also that SUNY is a state subsidized institution. So we are able to work with patients from all different financial backgrounds, all different types of financial abilities. And that is part of what makes SUNY so great, is that we are kind of the catch-all for the city, that every private practice, every retail optometrist, every type of independent practicing optometrist, if they're unable or don't have the technology, resources, abilities to care for a certain type of condition, usually something a little bit more specific or something that they've never seen before in their careers, it gets sent to SUNY. Or if patients don't have insurance and don't want to pay out of pocket, they get sent to SUNY.
Okay, I didn't know that.
And so we have a lot of incredible kind of financial programs that really, really work with patients based on, you have this debilitating eye condition, but you can't afford your medications. It's not, sucks, good luck. It's really all the faculty kind of in a room together saying, okay, well, like, what can we prescribe else? Like, what are the studies saying about the efficacy of drug A versus drug B? Like, how can we make this the most cost-effective procedure for this patient? And that's really, it's kind of like working on the front lines at the end of the day, is that we're not the cushiest institution. We're not the prettiest, or we don't have the Park Avenue beautiful marble white floors, everything like that. But you are receiving some of the best care in the city, because anything unique, anything interesting, we have some of the greatest minds in the building in the field of optometry. We have people conducting research constantly about new conditions. We have people writing case reports and presenting at conferences. We have doctors who have specialized in like one disease, one area their entire careers. And so yes, you have an extra long waiting time. The chairs might not be that comfortable. We don't have the kind of most entertaining like television screens on, or exactly, you're not getting a cushy, typical kind of private practice experience, but the trade-off is you're receiving the best care in this city. And so it's kind of something that you have to go into with a positive mindset. Obviously, every single patient is different and every single case is different, but majority of the time, the best thing to do is enter with a positive mindset. Bring a book, bring a snack. It's going to take a while.
So let me understand this. If I go to a retail eye care center, we'll mention names, but if they see something that they say they think is more serious, they do send them to SUNY.
Yeah, we definitely
I wasn't aware of that.
We definitely have a lot of referrals from private practices, from retail optometrists, from even providers that are not optometrists or eye care providers that think that maybe vision may be affecting a patient's functioning in some other area. Even psychologists may send patients to us. So we definitely get referrals from all different types of modes of practice.
And the eye exam at SUNY is going to be very, very thorough, because again, it is a teaching institution. So we are learning every possible aspect of a eye exam. We're learning the binocularity functions, we're learning the accommodative functions, we're learning the refractive functions, we're learning the kind of all the different aspects of the eye. Whereas in a private practice or retail setting, the exams are a little bit more tapered down. So it's kind of like going for a checkup versus like the general physical, and you're getting all your blood work done, everything like that. So like at SUNY, every single exam is going to be a very, very comprehensive experience. And so oftentimes we have patients leaving at the end, they're like, I've never had all that testing done. I've never had all this done. And it's, yes, because students are learning, and the way we learn is by performing these exams and providing this type of testing. And so most of the time is like the testing is pared down in a real life setting, because again, we have to remember that finances are always a part of opening a private practice or running a retail business. And I don't know how successful a private practice or a retail business would be if every exam took 4.5 hours.
Yeah, it wouldn't. I mean, I remember, I don't know for what reason, insurance or whatever. I went to a private guy it was on Park Avenue. I went there and I 2 or 3 times or so, while they were juggling the insurance, it was a totally different experience. It was less of a wait, but it wasn't as comprehensive. It wasn't what I was used to. And
you missed the wait a little.
I think all over the country, where there's optometrists, you're going to have different settings that have different ways of going about the care, whether it's, how long you wait.
So there's not any standard formula. There's not,
Well, there's definitely things that are part of a standard of care that are definitely gold standard for diagnosing, treating, managing a patient, but the care that you get can differ whether it's a teaching institution, private practice, retail, hospital setting, whatever it may be. You may enjoy one more than the other, and some may be better than the other from the patient's perspective. But if a doctor's providing the standard of care, then it technically doesn't really matter where you go.
Right.
If you are going to a hospital setting and they're doing everything that they need to do, as we're taught to do and as we're licensed to do, then it shouldn't be a problem where you go. I think patients' preferences on wait time and, the setting that they're in, the environment that they're in, that's on the patient. They can kind of pick what works for them the best. But, you may prefer a teaching institution, other people may not, and you might not prefer private practice and other people do. I think that at the end of the day, if the doctor is providing the standard of care that they should be, it doesn't matter where you go.
To tie this all together, for students who are out there who are considering going into the career, what don't they know that you'd like to share with them?
I think, at least from my perspective, I wasn't really aware of optometry when I was a sophomore, junior in college. I didn't really learn about it until my senior year.
Wow.
So I would do some research if you're in the pre-med area about what else is out there, in terms of how you can get involved, not just optometry, but in a patient's care, or in a person's care. There's so many different fields.
Exactly.
And my pet peeve has always been that they don't advocate for themselves. I wasn't aware that, okay, maybe you're having a little problem with organic chemistry, so maybe, medical. We didn't even talk about the requirements. That's the other thing I want to talk about. So I had a problem with organic chemistry. It didn't come easy to me, and I didn't buckle down on it. So I was like, okay, maybe medicine isn't my field. But maybe I could have looked at some other area of healthcare that unless you need organic chemistry too.
You do, because we do take pharmacology, which is all organic chemistry.
Yes.
Because we have to remember that optometry is a very legislative field, and requirements and abilities of what your license gives you access to vary state to state. So in New York, we actually just received permission to start prescribing oral antibiotics. So if you present with a viral infection or a bacterial infection, we're able to prescribe antibiotics to help heal that, rather than have you show up in our office. We tell you, yeah, you need antibiotics.
Really?
Here's a referral for a doctor who can give you antibiotics. It kind of gives us a little bit more leeway and a little bit more access to providing the best standard of care to our patients. And so I think for requirements for optometry school, definitely understand that it is a lot more medicine than you would think if you've never looked into the field of optometry.
Some people aren't aware the scope of disease that is covered in optometry. I think some people think, they're just prescribing glasses, but that's really not the case.
That's like the first layer of the field.
There's a lot that goes into the eye from the very front to the very back. And there's a lot of different topics covered. Some are easier than others for every student. So I would kind of research what are the requirements, what are the things that you're going to actually be studying once you are in optometry school, and the
how you can best prepare in the undergraduate program.
There's a lot of.
What did you get in organic chemistry?
I don't remember. It's been a lot of years. It's been a lot of years.
That was 5 years ago. I definitely didn't get an A, but I think I got a B.
You got a B?
Yeah, because you also need organic chemistry for the entrance exam.
Yeah.
Yeah. The entrance exam for school is called the OAT. At least it was when we were going through.
I think it's still the OAT.
And that covers a lot of different subjects, and it kind of changes, I'm sure, from year to year.
It's different from the MCATs.
That's correct.
Yes.
So similar to dentists who take the DAT, we take the OAT.
Yeah. Really?
I think the best.
I never even heard of the OAT.
Exactly. I think the best way to find out the standards and everything for it is going to be to reach out to the schools you're interested in, as well as looking up requirements because they do vary from school to school, and just making sure that you have a passion for people. Our staff are all residency trained, and they are brilliant minds. That's what it comes down to.
And they do part of the evaluation process, whether or not you get into school.
Yes, that we have an incredible admissions department that works very, very hard at what they do and make sure that every single staff member and every single student is part of the community at SUNY. And at the end of the day, we all have a common purpose and common goal, and we all kind of work united in the knowledge that we are here to treat people and to treat their eyes, and we're all passionate about what we do.
Well, what differentiates the two of you? Because everybody who comes to the interview says that.
I think our experiences and our passions are all different. The way we
People
want
skills.
to
Yeah.
put in effort in
Like,
our.
what questions do they ask you in the interview?
So a lot of times the interviews, this is across all optometry schools,
of
not
course.
just, SUNY. I'm not sure exactly what they're looking for because, we're not on the admissions
Right.
team.
Right. Okay.
But, a lot of optometry interviews will focus on your background, why you want to do optometry, what motivates you to do it, and why you think you would be a good fit, and what you bring to the table that may be different. I think at least when it came to my experience, I knew that I really liked working with people, and I really loved the work-life balance that optometry brought, and
Very important.
I found the actual field very interesting because it has a broader scope than you'd expect. It's not just treating disease, it's not just prescribing glasses. There's a lot of other really cool things. And I think they also focus on why you want to go to school in New York City when it comes to SUNY. So I think that's a big part of it as well.
Rent here, cost of living
it's
here,
amazing.
it's a huge commitment. And at the end of the day, I think that SUNY does a really great job of kind of teasing out the passion of their students.
Really?
That's pretty common along most, not only optometry schools, but medical schools.
PA programs,
definitely
PT
having some letters of
programs.
recommendation.
I did an intern program at Metropolitan Hospital, and I wanted to do it in just general medicine, but for some reason they ended me up in the dental clinic.
It kind of depends. I also think that in some physicians, whether it be like a medical physician or maybe an optometrist or a dentist or whoever it may be, they may not be comfortable with people shadowing, and sometimes the population may not be comfortable with people shadowing. So I think it's really important to ask around and don't get discouraged by a no.
Yeah, full disclosure, I went into the dental clinic, and first time I saw some oral surgery, I was like, excuse me a minute. So just as I get to the bathroom, I fainted. I was like,
Oh,
Happens to the best of us.
has it?
Happens to the
That
best
was
of
like
us.
First and only time, but I was like, maybe dentistry is not quite the subject for me.
100%.
Listen, it's been an enlightening discussion. You guys are wonderful.
thank you.
As I said, I am so grateful for SUNY, for all the years. As you well know, my eye history, I'm blessed, at this point, and hopefully I'll keep staying stable. But I want to thank you so much for coming.
Thank you for having us.
I'd like to have you again for another topic, just because you're such wonderful guests. And hopefully you'll accept my invitation to talk about
Of course.
maybe something more in depth about particular diseases.
No, 100%.
Wanted to keep it light, for the first one.
Yeah.
But,
Hopefully we were able to convince some people to go get their eyes checked.
exactly. That was the most important thing I wanted to accomplish today. And we'll go into more depth another time.
Yeah.
So
Thank
again.
you.
Thank you so much.
And thank you for listening, audience. We look forward to seeing you again. And health is wealth. It really is, because all the money in the world, $1.5 billion lottery, doesn't mean anything if you don't have your health. So thank you again, and we'll see you at the next time. Take care.